Hi everyone, it's Andrew Wynd here, foot and ankle physiotherapist, and I'm back with Darcy, Dore, Podiatrist, and we're running through our favourite exercises for the intrinsic muscles of the arch. Those are the small little muscles that affect all sorts of foot mechanics and the toes and the positioning of them, and they're really, really important. And so we're sharing with you each week a new clip showing what we show our patients every day, every week, to strengthen and get these muscles working as well. So you should be able to follow along and do these at home. So the one we're doing today, tell us about the one we're doing today, Darcy.
Today what we've got is essentially an exercise that we use with a band around the legs, and essentially what we're trying to do is engage quite heavily this muscle on the side of the foot. At the same time we're trying to turn on some muscles in the hip called glute medius. We're going to do what's called an isometric contraction, where we're holding force against a resistance. So we'll show you this one now. This one would commonly use, maybe not as a first exercise for a patient, but definitely when we're trying to progress the strength of these foot muscles, we would look to use this one a little more. So essentially what we've got is this band around the legs. We can have that usually around the knees. We're applying that force with the hips to an outside position at the same time that we are doing what's called the short foot. So I'm in the top of the movement right now. We'll relax and then I'll go through it again. So we'll relax just to a normal neutral standing position, and then to perform the exercise we turn those legs up, keeping the big toe joint, the toe on the ground, trying to make that arch come up as high as we can, and at the same time what I'm doing is pressing the band to the outwards direction, which is causing a contraction at my hip muscles up here. So essentially what the studies found, Choi et al. In 2020 found that we can get a significantly greater contraction of force through this muscle when we're using the band and the hip. So that's why we use it in clinic as a way to really get these muscles firing.
So you might not be able to see, but the muscles in this part here, that's called the Abductor Hallucis or Hallucis, depending on your pronunciation. But it's a big muscle that controls the position of the big toe. And for things like hallux valgus or bunions, really, really important that muscle is as strong as possible, because that's what maintains that optimal alignment. And it's quite well developed in Darcy. You can see his alignment's good, but that muscle is working very, very hard. I'm sure you're feeling that?
Definitely feeling that.
Yeah. How many do we do? What would you suggest?
I think per set we probably do in between 5 to 8 reps, depending on the person's ability, and would want to do at least 3 to 4 sets of that per attempt.
Excellent. And as you've already identified there, Darcy, we know from quite a few different studies, not just the Choi paper, that the hip and the foot work together in conjunction. So if there's an issue at one of those, then there's often an issue at the other. So if you're not progressing with working on developing your foot or addressing the foot pain, have a look at the hip and you might find an answer there too, which is why this is a great exercise.
Definitely very good advice.
All right, thanks for watching.